The title of this presentation is Breast Cancer Risk Factors and Disparities in Health Outcomes. When talking about risk factors and disparities, I also like to pair it with health literacy because health literacy is something that an individual can work towards in order to change kind of their circumstances when it comes to health outcomes. So I really like to focus on things that individuals can control because a lot of times disparities are outside of an individual's control or an individual's reach. For the agenda, first we'll start with an overview of breast cancer and then some risk factors. We'll talk about socioeconomic status and screening disparities as well as racial disparities. Then we'll move on to efforts to address those disparities and then, like I said, talk about health literacy in the context of breast cancer. So a lot of people know that breast cancer is very common in the United States. It's the second most common cancer and second most common cause of cancer death in women. It accounts for about 1 in 3 new cancer cases in the United States. So the estimates for 2023 are pretty high because there's a high incidence and prevalence of breast cancer. So they estimate that there are going to be 297,790 new cases of breast cancer. So as far as lifestyle breast cancer risk factors, like I said, I like to focus on things that women can control because a lot of times things are outside of their reach. So starting with physical inactivity, the American Cancer Society recommends that women get a total of 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity physical activity every week. This can kind of go hand in hand with overweight and obesity. So after menopause, being overweight or obese increases breast cancer risk. And this has a lot to do with the amount of estrogen and blood insulin levels that come after a woman goes through menopause. And also carrying more weight in your waist area can put a woman at higher risk for breast cancer. So talking about socioeconomic status in breast cancer, we found that women of higher socioeconomic status actually have an increased risk of developing breast cancer. And that's because of the risk factors that are found in this specific demographic. Moving on to some more screening disparities. Like I said, women of a lower socioeconomic status are at a disadvantage because they're less likely to be insured and they're more likely to be recipients of Medicaid. As you can see, those who are uninsured have a lower chance of having a mammogram in the last 2 years at 42% for the year of 2021, but those who have private health insurance, 80% of those women had a mammogram in the last 2 years. Talking about race in breast cancer, it's well known that Black women have the highest death rate, but a lower overall incidence than white women. So if you take a look at the chart on the right, the incidence for white women is a lot higher, but the mortality is a lot lower than Black women. So there are many reasons why disparities are present for Black women. Statistically, they have a higher prevalence of a lot of diseases such as diabetes, heart disease, and obesity. They're also less likely to breastfeed, and they also have statistically higher poverty rates. So some of the ways that state departments and local communities have been addressing these disparities are by making sure that there are programs implemented that they can provide these women with follow-up appointments when these abnormal screenings are taking place. They can also develop screening methods that make it more sensitive to detect the triple negative tumors that we talked about on the last slide. And then there are also statewide screening programs that are increasing the access to underserved populations such as Black women. So that brings us to health literacy. After we talked about the risk factors and the disparities, now we're going to talk about kind of what individuals can do to take control of kind of their health and learn how to better navigate their breast cancer diagnoses. So health literacy is particularly important for women with breast cancer because when you get diagnosed with breast cancer, you're being faced with a lot of complex and a lot of large decisions. You're dealing with so much information and you really have to know how to navigate it. If you're going through a lot of tests, you need to understand and be able to interpret those results, understand what to do with the information, what kind of follow-up is needed, and all in all, just dealing with navigating your access to services. A lot of times with cancer, you're not just seeing one doctor, you're seeing many different types of doctors. So it's important to know what each doctor does, when you need to contact them, and who is the best person to contact at each point in time throughout the diagnosis. So starting with what providers can do to increase health literacy is first just identifying what a patient's literacy level is. So really knowing your patient and knowing how they best learn can do a lot when it comes for the patient to retain the information. And for what you can do if you're diagnosed with breast cancer is Know if you are visually literate, computer literate, verbally or numerically. So if you know that you're a visual learner, maybe tell your doctor, hey, like, can you provide a diagram, or can you provide an image that best describes what you're saying? Can you provide a YouTube video or some type of video that will better explain, that you can send me home with? And then also being sure to take notes on what a doctor is saying and write it in a way that you understand. Make sure that you have all of the information possible can be really beneficial for helping you navigate your breast cancer diagnoses.